Greetings from beautiful Denver, Colorado. My name is Dr. David Dijak, Executive Director of the National Environmental Health Association. Our association is excited to partner with ecoAmerica and Climate for Health to support climate solutions and actions. Let's face it, in the news every day we see how climate change is affecting environmental health, our air, our food, and our water, where we live, where we work, and where we play. Environmental health is profoundly local, as you know, and our professionals improve and protect communities all across this great country. As you will hear from our members, when communities engage and collaborate on climate change, partnerships and solutions arise.
The City of Cambridge has been thinking about climate change for a long time. We had to shift our focus to adaptation. Cambridge itself, it's north of Boston, it's on the Charles River watershed and also the Mystic River watershed. We are protected from Boston Harbor by 2 dam systems. By the year 2045, those dam systems might not protect us anymore. So we just started to think about adapting to flooding. Where can we store stormwater if we had a flood event or a rain event that was dropping, say, 11 inches of rain in 24 hours? Our city engineers have designed a series of underground storage tanks that would serve as temporary holds for that rainwater. And the barrier that we face was competing priorities, especially among our vulnerable population, folks who might have more pressing concerns. The challenge was really finding common ground to connect with on why you should think about climate change now as opposed to when an event happens. Through Climate for Health and ecoAmerica, one of the resources we've used is the 15 steps on communicating effectively about climate change. And I think starting where people are, connecting with people and using stories, that's where we're making the most progress.
In the next 30 years, the population of the Salt Lake Valley will double.
Probably one of our biggest concerns is the diminishing snowpack.
It's falling later in the year, it's melting earlier at the end of winter, and less snow is accumulating. So we're able to capture less water year after year on average.
So our primary job is to control air pollution in Salt Lake County, and the silver lining of climate change response is clean air. And that's really the only way we're going to get it in a lot of major cities is to have electric vehicles and zero emissions homes. When we're concerned about making affordable housing, it's important to look at the long-term expense of operating in a house, paying energy to keep it warm and keep it cool, to wash clothes, to cook. And so when you're building the house in the first place, if you build it right, you can significantly decrease those costs. Salt Lake City just recently opened a zero emissions fire stations, the first in the nation. These are things that are happening right now that we can be doing, just as a matter of making an individual choice to do them.
Being a part of NEHA has been important for us in working on climate issues. Through that connection, drawing information that we might not otherwise have access to.
In Ohio, our Ohio Public Health Association recognized that there was a lack of statewide funding and also lack of a coordinated effort across the state by local public health departments to address the health effects of climate change. And so we at Franklin County Public Health had an opportunity to be a part of the Ohio Public Health Climate Resiliency Coalition.
The coalition has a lot of other people in it. There's academic, local public health, and students. Once we were on the coalition, we realized we didn't really have internal policies either. We looked internally at our policies and really took a look at what we needed to do to build up. What we did was take this huge issue of climate change and really drill it down to how this impacts environmental health. This is what we need to look at, and this is why.
NEHA was very supportive of our efforts and extended an invitation for us to be a part of the Climate Change Committee, which was extremely helpful. Having those resources and those connections on a national level made it real.
Through our partnership with ecoAmerica and Climate for Health, our association, the National Environmental Health Association, is providing environmental health professionals with tools and resources to lead on climate. Join us to make climate change a national priority.